Happy New Year and welcome to the Osteoarthritis Action Alliance Lunch and Learn for January 2016. My name is Kirsten Ambrose and I appreciate all of you taking the time to join the webinar today. I'm pleased to introduce our presenter, Dr. David Sabgir. Dr. Sabgir is a board-certified cardiologist practicing with Mount Carmel Clinical Cardiovascular Specialists in Mount Carmel, St. Anne's in Westerville, Ohio. Dr. Sabgir is also the founder and CEO of Walk with a Doc, which began as a local attempt to get his patients out of the clinic and onto the walking trails, and has since grown into a much larger program that seeks to encourage healthy physical activity in people of all ages, with chapters across the U.S. and 5 other countries. His efforts have not gone unnoticed. The Surgeon General, Vivek Murthy, has highlighted Walk with a Doc as a strong example of grassroots effort to build a culture of prevention. Dr. Sabgir has also been recognized in CNN Heroes, Huffington Post, Harvard Health, and some other notable news sources. Today, he will tell us about Walk with a Doc, its purpose and successes, and how you can bring a chapter to your community. Welcome, Dr. Sabgir.
Good morning or good afternoon, I guess, depending where you are. And thank you for the honor to present. We'll go ahead and get started. I guess before we do, I would like for you, and I probably don't even need to say this, but as we talked this morning, if you could look at this as a program, something that you might want to bring to your community, and please come up with any questions along the way, because we've had a lot of chapters start, and we've seen and heard pretty much every question, but I'm sure there's still some out there we haven't, and we would love to help you bring this to your community and see if it can make the change that our other communities are seeing. I would imagine most of you do not know what Walk with a Doc is, and again, I appreciate the opportunity to bring it to the forefront for these next 18-20 minutes. Our mission is to encourage healthy physical activity in people of all ages in order to reverse the consequences of a sedentary lifestyle. And I hope that's the most boring portion of our talk, but it's something we need to have, and that's what we're aiming to do. Our goal is big. We want to have a walk in every community so everyone has the opportunity to do this weekly or ideally even daily. And our approach is that, you know, if the fast food restaurants can do it, we absolutely can. It's a lot easier to set up a Walk with a Doc than it is to open a McDonald's. Okay, so what's it look like? It is the doctor at each event, but you know, let me get out in front of that and say that the doctor is not the magic ingredient. We'll get to what that is, but if it does help get someone initiated in physical activity, we're going to try and take advantage of that. It's a physician-led event at a local park. We keep it at 1 hour a week or a month. Of our close to 200 chapters, we would say about 65 are weekly, another 50 or 60 go twice a month, and the remainder go once a month. We are not an annual event. We don't fundraise. We're here to break down barriers and show how easy it is. We have, in addition to doctors, we'll have nurses, exercise physiologists, dietitians, depending on which community you're in, greet walkers. We have, most of our sites have coffee, water, fresh fruit, granola, things like that. And then we have blood pressure checks. That's good, of course, to check the blood pressure, but it's also in a goofy way kind of nice, a nice moment when you have those 2-3 minutes with someone where you're, you know, in a quiet setting, talking to them, maybe answering a question while you check their blood pressure. It's a really nice moment of the walk. We do that before and after the walks if people want. Most of our walks provide pedometers. We like that because there's some people that, you know, won't be able to do the mile loop, and every site has a different course and different path, of course. But some people can only walk a 1/4 mile, but they'll come out Heck, we have some people that are no longer really even stable to walk, but they appreciate the social interaction. It's been such a staple in their social life that they continue to drive out even if they're just going to hang out at the pavilion. That's a small percentage, but it's a nice thing. At the beginning, the doctor will talk for a few minutes. You know, Dietary Guidelines is a good example. That just happened, so we spoke about that at our site. Last week we spoke about the side effects from blood pressure medicines. You know, with the new study, the SPRINT trial was just released, and it showed that they want patients' blood pressures to be 120 or lower. So we had talked about that about a month ago, and then Saturday we spoke about the side effects of medicines. And you know, mostly it's a social thing. There's a lot of chatting, a lot of smiles, a lot of happiness, which of course only grows as the activity increases. Everyone is a volunteer at all our sites, and there's never a fee for the participant, and the cost for a physician or anyone who wants to be, we call it Batman and Robin. Batman is kind of the person who brings the walk to the community, and Robin is often the doctor that does the talk. For that, we just charge costs, and we can get to that. And then it's walking. We try and keep it as simple as it is. At just 1 hour a week, we find that walking can be the gateway drug that can show people, our goal is to show how easy it is and how fun and refreshing almost it can be. In the 3 to 5 minute talk, we put that in our agreement with new sites because, in short, the community members love it. They eat it up, so we want that to be a part of the program because it will help our sustainability and long-term viability. And you will be immediately impacting your community in a big way, a very positive, life-changing way. And the walk, it breaks down barriers. You will find, to get back to the third bullet point, that I think of our 190-some sites, I would say 180-some have been on TV or been in the paper or something, because it's just a nice story and it's a great service that these local leaders are providing to their community members. But we break down so many barriers. If it's barriers between the doc and the patient, that the doc is wearing a ball cap and jeans at the park and is, I hesitate to say, but more easily approachable, or you know, there's socioeconomic barriers, racial barriers, that everything gets thrown away at the walk, and it's a really nice setting. And the secret ingredient, of course, is camaraderie. This is one of our walks in Las Vegas. I'm sorry. So why walk with a doc? All doctors know that the risk of heart disease can be reduced by 34%. Even, you know, cardiovascular disease, which I'll allude to later, is 80% preventable. I'm a cardiologist, and I'll see, you know, so many patients come in and their grandfather had heart disease, so they figure they're pretty much destined to get it. That's not the case. So one of the things we really try and drive home is that the ball is in our court as patients. We're in charge. And then we'll get to it, but you know, women with breast cancer walk 2 to 3 miles per hour, 3 to 5 hours a week. Their death rate's half that of sedentary women. If you've had breast cancer, there's a 53% reduction in risk if you walk at that pace. This is why we love Walk with a Doc, because it can be the cure. Walking can be the cure. We just have to do it. And it boggles my mind that we're not, you know, as a nation, as a you know, world, broadcasting this, shouting it from the mountaintops that we don't have the whole cure, but we have a lot more than we're giving ourselves credit for. We just have to employ it. Here's the obesity trends. We've all seen these slides, and of course this would, I'm sure, mirror the growth in incidence in osteoarthritis. And, you know, a quick aside here, before I got into the walk, I hate to admit it, but I used to think that the pathway was, okay, obesity, then you walk and you'll lose weight, and then you'll get all these benefits. Well, someone that weighs 250 pounds and walks, you know, 150 minutes a week or whatever their favorite flavor of exercise, they're arguably going to be, well, they're certainly a ton healthier than the person that's same weight that's sedentary. That goes without saying. But I would argue, and I would love to see a study, they're likely a lot healthier than someone that's, say, 30, 50 pounds lighter that's sedentary as well. So I think we need, while obesity is a big part of it, exercise can be somewhat of a bypass to that. So why did we start Walk with a Dog? We started in 2005, and in short, we just had to. I spoke about it with patients, and because it's so critical for so many reasons, and it turned out, while I felt, and I do think in the office I was really connecting, and I was proud of myself. I thought I was doing a good job. It turned out I was horribly ineffective. That when these patients, we're based in Ohio, so when the patients came back 6 months later, it had either been too hot or too cold, and then, you know, the same thing repeats in 6 months, and I was really getting nowhere, and it was disappointing because I was looking at, you know, this was right out of training, and I was looking at the next 30, 35 years, and I'm, you know, thinking to myself, this is really a charade. These talks are, you know, you have to have these talks because they're so critical, but they're not working at all. So one day, out of frustration, we just said, how about if my family and I were at the park, and I had, at that time, 10 years ago, 2 very young children, I think 2 and 4, so decided that I wanted them to be at the park, and something just kind of clicked. But again, I digress. 80% of cardiovascular disease is preventable, and there's a very small percentage of the U.S. is exercising at this rate, and there's over 50 diseases. I used to think that it was cardiovascular disease and maybe a cancer too, but it affects over 40 and probably 50 diseases, and some of them, just to briefly go through them: coronary artery disease, CVA is short for stroke, as you guys probably know. Heart failure, osteoarthritis is, you know, if someone has arthritis, as Kirsten would tell you, you can really improve. It's the #1 treatment for knee osteoarthritis, in my opinion. COPD improves. All these cancers, you know, who would have thought leukemia and lymphoma are dramatically improved with exercise? And, you know, of course, diabetes, osteoporosis, a bunch of mental illness that also include schizophrenia. So we really have the magic bullet, the miracle drug. I think, you know, what you often see in the press, and I agree with this 100%, is if this were in a pill, you would never be able to find it. You'd never be able to afford it. And I know I'm preaching the choir, but that's kind of the passion that we work with here at Walk with a Doc. So what does exercise do for arthritis? All stuff you know: increasing the range of motion, strengthening muscles, building endurance, and improving balance. So it's critical for that. Where we are right now, currently, I think we're either at 197 or 198. We've had a fun day here where I think we've added 2 or 3. And right now we're adding, when I turned the slides and I said 1 to 2 a week, I think the last 4 weeks have been 5 or 6 sites a week. So it's been terribly exciting. When I talk about walk events, that would be, if a site goes monthly, they have 12 events. So Cuyahoga Falls, Ohio goes the first Saturday of every month. That's 12. And we had, I think, 2,400 walk events in 2014. And we believe we reached about 170,000 people. Metrics are obviously paramount to everything. And we have a very goofy newsletter that we send out on Friday mornings to try and educate, but also, break down the barrier to this, wonder drug and get as many people taking it, if you will, as possible. We surveyed the group and found that 92% of people feel more educated through both either the exercise physiologist or the doctor or the nurse or the dietitian who's speaking at the event on Saturday morning or whenever someone chooses to do the walk, or through the newsletter. If you walk half an hour once a month, is that going to affect change? Of course not. But we have found that 79% of people are getting more exercise, and they're getting together for walking Wednesdays or meeting on Tuesdays and Thursdays. And then once you break down that barrier of showing that, look, you can do this. And again, I would say over 95% of the people I see in the office are not doing anything to speak of. So it's a real epidemic out there. We're excited for that number. 78% feel more empowered to not only tell their doctor, hey, I've seen your like before with ball caps and blue jeans. You're a real person. I have a question. Why are you ordering a $1,700 test on me? So they feel more empowered there, but they also know that, hey, just because my grandfather had heart disease, now I know that I'm in charge, not my grandfather, and I can reduce my risk by 80%, so I'm going to be on top of this. And they do. We're very honored and to be able to do Walk with a Doc, because we get calls, every hour, every day from doctors and from participants that they appreciate it, and that's why I may be talking with hurried speech now. We really have seen that it may not be the total answer. I'm not crazy. I may be crazy, but it may not be the total answer, but it's a winner right now, and we want everyone to be able to capitalize on it. Our current sponsors and relationships, often our calls come from doctors or hospital systems, and we've got a ton of exciting stuff coming up. It was kind of you to mention CNN. That really tipped us, and the Surgeon General also tipped us in a very positive way, that we're now talking to groups that we never dreamed of and will be allowing us to fulfill our vision quicker than we had initially hoped. If you do care to start, please give us a call, and our number will be on the slide, or you can ask. We will send you everything you need, communication tools, marketing tools. The liability is a big one. We're always here all the time for hand-holding or whatever you need. If you have any questions, we've been through it. And then eventually we send you a starter, or not eventually, we'll send you a starter toolkit. I did a lot of my training at Ohio State in Columbus here, and some of the grand old doctors that trained me went by Peabody's quote, which is so true, and I feel probably the most applicable quote. The secret of the care of the patient is in caring for the patient. And one of our Denver leaders, Andrew Freeman, a cardiologist out there, shared that there's no better way to show this person that you care about them by meeting them outside the setting and spending time with them. So there's a lot of power in that. There is our contact information, our phone number, and our website. And again, I want to thank you for the honor of speaking, and would love to answer any questions. I'm biased, but doing this for 11 years, I will tell you, you cannot go wrong by doing this. You have really nothing to lose. And thank you.
Thank you, Dr. Sabgir. We're big fans of this program, as you well know, here in Chapel Hill. We just started our own chapter in the fall, so we're rolling along with a couple of talks, but I've got a question related to that. I'm sorry, a couple of walks, not a couple of talks. But we have a couple of questions that have come in, and one relates to one that I was going to ask you. So we'll go ahead and start with Pat, who asked, how do you find a doctor or healthcare provider to do this? Not so much on your website literally, but what is the value for them? How would you identify somebody in a clinic to take this program on?
Yeah, great question. Well, first of all, we have, we get that question a lot, so we do have some electronic information. If you want to contact us, we can get it out to you on recruiting doctors. Typically, it's going to be a doctor who is physically active themselves. I think I saw a stat that 38% of doctors now kind of reach these 150 minutes a week, so it's typically going to be someone in that group. But it's usually some networking, maybe. What we have found is easier than people think, but that is the biggest thing. And we also, we're working with some organizations that can reach out there. So the best thing I could say would be contact us, let us know what area, and we'll get you a tip. I don't know if it has 10, 15, or 20 recommendations on reaching out to doctors. Usually, once the word gets out, there's a buzz, and you'll find someone pretty quickly.
Well, and somewhat related, but from the other side of the coin, and this speaks to what I was going to ask you, we have another participant who would like to know, how do you recruit participants to walk?
Yeah. Again, we've got sheets on marketing tips for that, because we want that as much as you want that, because the more people that get out and walking. But it is, I'll tell you, there's real quickly, there's 4 levels. There's, if you are in a medical setting, we have prescription pads that are for Walk with a Doc. We have posters, cards, flyers, and then you can start getting out in the community level, putting, a poster up at Starbucks, things like that. Once I hate to go on about this because we have sheets that do so much justice, but you will inevitably get an article in the newspaper or TV that will bring a bolus of people out. It's not a magical thing where you stick the the Walk with a Doc banner in the ground and people come running. But on the flip side, we have found almost to a site that you get out of it what you put into it. It's the perfect example of elbow grease. So if you want to have 60 people or if you want to have 120 people, we've got, we'll give you all the advice, and we're not going to charge you. It's just I can't think of anything off the top of my head. As far as we won't charge you for that information. I want you to have the complete access to it.
Another question that came in, the Arthritis Foundation has a similar walking program called Walk with Ease. Have you had any overlap with this program in any of your communities?
We have not, that I can think of. I am sure there's been a little overlap that I'm unaware of at a site or two, but no, we have not. Teamed up with them. I think just between us, I think we tried to talk to them to see if there's interest a few years ago, and I'm not sure that at that point they were ready. But no, I think I've heard about it, and I know it's a wonderful program.
Well, and just one thing to that end, I know that the Arthritis Foundation has recently developed a resource finder, and you might be right on the fact that a couple years ago they may not have been ready. They had undergone some transition with their leadership and so forth, but it might actually be a pretty good time to reach back out. They've got the resource finder, like I said, that is aimed towards providing community-based resources for folks. So that could be a potential way to connect.
Yeah, we will do that, and yeah, we've heard nothing but great things about Walk with Ease.
Have you published any of the results that you've of your successes?
Not in peer-reviewed journals. We're almost operating out of a garage here, so that's my excuse. Is my time is either spent, as a full-time cardiologist or getting walks started. We are, meeting with some larger groups, and we're having some students from Ohio State work on that right now because it's so important, but no, we have not published.
So we do have a couple of other questions that have come in, but I wanted to interrupt the Q&A briefly since we're coming up on our half an hour. For anybody who needs to leave the session, just wanted to thank you for joining us today and to check out our February 17th webinar with Dr. Kenneth Cameron from the Keller Army Community Hospital in West Point, looking at OA in military populations. So check that out. And for those of you who can stay just a couple more minutes, we can go on with just a couple more questions that came in. One being, does every Walk with a Doc chapter have to be initiated or led by a physician? Could a physical therapist start a program that is part of your organization?
Yes, please. The short answer is yes. I would say please give us a call. We do have a doctor involved with every organization, but we've had many started by a physical therapist where they are, kind of, to go back to that Batman and Robin thing, they're Batman and there's a Robin, a doctor that will, just, I would say give us a call and we can absolutely go through it. A lot of stuff is individualized.
Okay, now someone is working in an inner city area that does have a local hospital. Safety is an issue in this city. Have you run across any safety problems or ways to work around it?
That's a great point, and we're talking with the National Recreation and Park Association right now. That's one of the groups we have an honor of talking to, and safe routes is, if not their #1 priority, right up there. I think it's their biggest priority, and that's, of course, getting to the park or getting to an area, and then once you're there, being safe when you walk in it. Yes, I want to acknowledge that is a big issue for a lot of areas. We've teamed up in Columbus with the city of Columbus's public safety, so a lot of times there will be a police officer, but what I also will add is, when you're walking in a group, if it's 5 or if it's 50, there's an innate safety that is, are we ever completely safe? Of course not, but it's a lot safer to walk in a group of 10 than it is to walk alone. So it's, often the public safety department is very interested in helping out, and that would be a recommendation.
Okay, so looking at a real purely community perspective, can anyone start this at their church? I think
yeah, we've had many started at churches, and we've actually tried to go the other way where we've had some started and then we go to faith-based organizations to see if they want to participate, and we've had a lot of success there. So yes, one of our very first walks in Columbus was a Zion church where they had 60, 70 people that walk with a doc every Sunday after church, and we think that's fantastic.
And I would echo that enthusiasm from our experience here at UNC. We've done some research with Walk with Ease, looking at Hispanic population, looking to see if we could take a Spanish translation of the Walk with Ease program and bring that to a Hispanic community. And we recruited largely from churches. That was one of our biggest populations, and they were extremely interested and motivated and very forthcoming with their participation. So I would agree with that from the Walk with the Doc perspective.
Great.
One more question. This person lives in an area that has heavy snow cover several months out of the year. Are indoor walking sessions common in such areas?
First, I want to say thank you for all the questions. We don't always usually get this many, and I love it. We are in Columbus where it's 10 degrees, or we walk in the mall from after Thanksgiving until Easter usually. And my brief anecdote there is, I remember I was kind of Grizzly Adams. I wanted to be outside all the time, and I didn't care. I wasn't going to walk in a mall come hell or high water. And then one day in January, about 10 years ago, I was standing outside my minivan, shaking, trying to pour coffee in like 5-degree weather to 9 people. And I said, this is it. This is crazy. We're going into the mall next week. And we had 95 people the next week. So our thing is getting as many people out as moving. And, yeah, we have so many sites. And we see the flip down south where, you know, it's too hot to walk in maybe Little Rock or you know, in, I'm trying to remember, Phoenix in August. So they go inside the mall at that point. And we don't care. There are certainly additional benefits of walking in nature that, you know, I'm sure you've seen in the press and are very important, but personally I think those are counteracted with heavy snow cover. And, you know, my wife's an attorney, and the last thing we want to do is have people walking on ice, you know, as a physician and as an attorney. So, yeah, we go into the mall, and that works out extremely well.
And I would say for our chapter here at UNC, we have we walk in a location that actually has an indoor track. It's a wellness center at UNC, and we've worked out with them that on days of inclement weather, we can go inside and walk on the walking track there. So that's another option. And then, of course, I'll have to plug our October webinar that we had in 2015 with Basha Belza about mall walking programs, and slightly different than Walk with the Doc, but the point being that, you know, it's an indoor mall walking scenario. So that's definitely a viable option. I agree with you. I think it will bring out a lot of people who have concerns about unsafe sidewalks, tripping over cracks or roots, or just bad weather, you know, that kind of thing.
Sure.
So unless anybody has any further questions, I haven't seen any come in. I have seen a few thanks to you, Dr. Sabgir, for your presentation today from some of our attendees, and also from myself. I appreciate your taking the time to join us today and to share the program with us, and I hope that people will take it to heart and open a few more chapters around the country.
Well, it's our pleasure. It's really been our honor. So thank you guys for your time. Mine's no more valuable than yours. So, and if you have any questions at all, please feel free to give us a call. You know, one thing didn't touch on in closing is cost of the program to get started. And we basically our model is that we have a few corporate sponsors that allow us to get the program to you at cost, because the last thing I want to tell Dr. John Doe when he contacts me to start the walk is, yeah, it's going to be X amount of money, when they are already volunteering their time and their energy to do this. So that's our model. And, you know, there are times where we offer scholarships or mini grants too to get started, just if it's the right situation. So thank you so much for your time, and I hope that I can cross paths with some of you down the road.
Thanks very much. Thank you, everyone, for joining us today, and we'll see you again in February. Have a great day, everybody.